We're going to demonstrate today how to drain a PleurX tube using the bedside 550 milliliter drainage kit that comes in your car. The kit comes with a bottle and a sterile dressing kit inside in case you need to change the sterile dressing. The PleurX drain does require a sterile dressing. However, if you are draining it multiple times per day, you can leave the pigtail end of the drain out and only change the dressing daily as per policy. So to start your drainage, you need to know that if the pigtail's out and you don't need to change the dressing, it is just a clean technique. So you will grab your bottle, being sure that the roller clamp is closed so that you don't automatically apply full suction to your patient. On the top of the bottle is a safety valve so that the bottle doesn't get accidentally punctured and lose its suction, and that pulls off. There's an arrow that demonstrates just to the side. Now you will take your cap off of the patient's PleurX drain and clean the hub of that catheter with an alcohol prep. The catheter itself has a one-way valve, so it should not leak or splash or draw air in if it's used as a chest tube. However, we still recommend that proper PPE be worn while draining a PleurX tube. Next, you want to grab the extension tubing on the end of the bottle, remove the protective sleeve, and connect it to the port on the PleurX drain. You'll feel a slight click and know that it's connected. Before you open the drain, it's a good idea to do a blood pressure and quick assessment of vital signs on your patient, because fluid shifts in the body can quickly cause a shift in vital signs as well. So you want to be sure your patient is tolerating the procedure. Now that you have the tube connected, you can grab a hold of the drainage bottle and puncture the seal in the top of the bottle, which then activates the suction. Then you slowly unroll the roller clamp while carefully observing your patient. The order set to drain a PleurX tube should contain how often and how much fluid to drain from your patient. Once you have acquired the ordered amount of fluid, you'll close the roller clamp.
Denise, how much fluid does this bottle hold?
550 milliliters. So if you have an order for more than that, you would need to make sure you have a second bottle on hand. Now that the roller clamp is closed, you can remove the drainage tube from the PleurX itself. That all gets discarded in a red biohazard bag in the biohazard trash. Clean your port again with an alcohol prep. And as you gathered your supplies, you gathered a new cap. We cannot reuse those caps. So the caps are available in the PAR, and you reapply the cap and secure the PleurX drain to the patient. If you need to connect a PleurX to continuous drainage, there is a package in your PAR with a kit that contains a tubing that is designed to fit to the atrium tubing. The connection process is exactly the same. And once you are connected, again, gradually unroll the roller clamp as the patient tolerates until it is in a full open position, which is where it should be when it's connected to continuous drainage.